all so much for coming. There's a tremendous amount of people I know professionally, family, friends, and I'm just so blown away by the support and very grateful that you're all here helping us celebrate the launch of SunCloud Health. SunCloud really came to be as it was a combination of clinical passion that I have to treat women and men with complex co-occurring disorders in a very integrated way, in a truly integrated way, which just doesn't happen at too many places. The area that I have specialized in for the past 10 to 15 years is treating women with co-occurring eating disorders and substance use disorders, and doing so in a holistic way, doing so in a way that really gets at the person as a human being, that meets people where they're at. We know that anybody, many of you who are doing this work know that regardless of how good of a treatment product we have, it doesn't work if the person isn't willing to take it or do it. So we're very, very grateful to be here. I want to share with you a few of our clinicians, and these are people that I've picked and that have come to us based on their clinical experience, and also the kind of human beings that they are. All of the clinicians here believe very strongly in self-practice, being collaborative with our patients, being honest with our patients. We believe in the both and, we believe in both medication-assisted treatment and 12-step facilitation, both, addressing the biological aspects of these illnesses as well as providing a robust psychosocial, spiritual treatment. And all of the clinicians who are joining us embody that and really believe in that as well. So Marcia Nikow is one of our group therapists, specializing in all sorts of addictions, process addictions, substance addictions, and co-occurring disorders. She's also a trauma specialist. She's a group therapist, has written group manuals for the American Group Psychotherapy Association. Beth Fishman joins us as well as an addiction specialist, particularly with an interest and a passion for spirituality, and also with an interest in developing a program specific to Jewish people. I spent the last 10 years creating and building Timberline Knolls, which is a residential out in Lamont, and we had a Christian component to our program, and I always wanted to add a Jewish component to our program, but it never quite happened. So I'm very excited to have Beth with us, and I'm very hopeful that she's going to put together a wonderful addition to our program in that way. Shale is here somewhere. Shale Marks is a CADC and a social worker who's going to be focusing more on the adolescent population and really doing a lot of the 12-step facilitation work as part of our group therapy component here. And then Tori Crone is our clinical director, who is just an amazing woman. She did a tremendous amount of work to make this evening happen. She brings a tremendous amount of ACT and dialectical behavior therapy expertise to our treatment team. And I'm very, very grateful that she wanted to join us based on an ad that the last person that I'll introduce posted on Indeed, David Newton, who is our operations / finance / compliance guy, and also my husband. And David and Tori really have done all of the work of creating this space, making it look beautiful. And one of the things that was awakened in David at Kellogg was a passion about value-based healthcare and really applying it to mental health. And he's very serious about that. There are a few Medicare, Medicaid programs across the country that have tried to use it. And this is something that we're pursuing very passionately with a focus on value. Value as defined not by insurance companies who are cutting people short of treatment to save money, but value based on how well is this patient doing a year out, 2 years out, 3 years out, 5 years out, 10 years out. We're in it for the long haul with our patients. We're in it to measure outcomes and to be accountable for the care that we provide. And David is really the brains behind the value-based care component, which is what attracted Tori, not me. You know, like, she was like, I don't care who the medical director is. I'm interested in this value-based care thing. So he has lots of connections with people at Harvard Business School who are serious as well about getting this model off the ground. And it's the direction that we're headed and hoping to pioneer this for mental health. So thank you all again very, very much for coming.